One of the amazing things about our campaign for U.S. Congress is my ability to go around our part of Minnesota and talk to small business people. This visit to Karcher Foster Services allowed me to talk about so many different things. As I sat down with Butch Karcher, he told me about how Obamacare is not only hurting his business, but also hurting his clients, the most vulnerable amongst us. And people are afraid to actually utilize that care. And so even though they have a card that says they have health insurance, they don't have access to health care. As a matter of fact, in most of the cases, they actually have less access to care because their deductibles and their copays are so much higher. They can't actually afford to go and use the insurance.
And that actual effect, as a business owner, I have actually seen those effects. A few years ago, I used to offer health insurance 100% for full-time employees. I now follow their guidelines. I have to pay, I think, 80% or 70% of the premium, which of course has gone through the roof. So now I have a lesser plan. I'm spending more money, and I'm starting to get more employees that finally they got fined. So now they're starting to come forth and say, okay, I need the insurance, but they simply can't afford to use it.
And folks like you are getting squeezed, but it's not just you that's getting squeezed, it's your clients. Your clients are paying the ultimate price.
The end user is definitely suffering. You know, the bureaucracy, the paperwork prevents us from actually spending quality time with the clients. We're spending more time in doing paperwork than administering the services.
At the rate that you're going, the way things are trending, you may not be in business this time next year.
When I talk to people about closures, because the senators, some of the senators and the representatives will say, well, we haven't seen that many go out of business yet. We'll start paying attention when they start to go out of business. That's literally been said to us a time or two. The problem is they've been acquired. So companies my size are being absorbed by bigger companies. That's why you're not seeing the actual closure. And I don't want to sell to a bigger provider because then the quality of service, it's hit and miss. The other thing that we're getting out of the actual hospitals is there's a real big push for DNR, DNIs. You know, they're trying to limit costs that way too. And when our state starts having conversations about euthanasia and assisted suicide, you know, physician-assisted suicide, I believe a lot of that is the end result of we just don't want to spend money on them. You know, our compassion for individuals is disintegrating.
All this ties in to one another. I mean, nothing in the healthcare economy ever stands on its own. And of course, I saw it in my own little corner of experience in running Fleet Farm's self-insured health plan. But I could look out at the greater economy, medical economy, and seeing what was taking place, what was happening in the healthcare marketplace.
Right.
And I understand not the microeconomics that I was involved with, but the macroeconomics and how it had affected our plan. And so when you start talking about the issues that you have, I can just see how everything is cascading down for what from what our federal government has been trying to do to us since 2010. As you can see from my discussion with Butch, the Affordable Care Act has not only negatively impacted his business and his employees, but those vulnerable citizens that Butch so compassionately takes care of. When you have Governor Mark Dayton saying the Affordable Care Act is unaffordable, and Bill Clinton saying Obamacare is the craziest thing he's ever seen, even the Democrats must admit Obamacare is hurting a lot of people and must be repealed and replaced.